Welcome to the Bay Area Mental Health Hour. Today we're taking a look at essential workers. They're on the front lines providing services that threaten their health and safety during this coronavirus pandemic. Some have chosen not to work or serve, while others feel they don't have a choice. They want to be on the front lines. We'll also take a look at losing a loved one to COVID-19 and just how to cope under the circumstances with that. I'm joined today by my co-host and resident clinical psychologist, Dr. Jaseon Outlaw, clinical director of the Journey of Life Psychological Incorporated. Hello, and thank you for joining me, doctor, again.
We are back. We are back. I'm excited to talk about a very important topic. COVID-19 has persisted. We have survived as a whole, as a species, but of course we are enduring rough and tough times. And so I'm very excited to cover a couple of topics that are related to COVID-19 from a mental health perspective. And it sounds like we got a couple other topics that we may get into today as well, which I'm all for. So let's get on into it.
Yeah, so let's just start with this whole idea of essential workers. I mean, many of us have either seen the medical workers online who have expressed their fears and frustrations with the effects of being, at their hospitals or in the clinics without personal protective equipment, and they've been expressing the frustration of not being able to help their patients who are dying alone without their family members, for example. And I can't imagine what that is like. For those nurses and medical workers, they're the only ones there with those family members who are
Sure.
sick and, dying, So those essential workers are much like the firefighters, the EMTs, the police, on the front lines there and seeing things that we can't even imagine they're seeing, hospitals filled with people on gurneys. You've seen those pictures online, haven't you?
Of course.
And so let's just talk a little bit about how these essential workers are presenting their trauma.
Well, let me say this first. It doesn't look the same for everyone. You have some essential workers who are really feeling honored and almost feeling as if a subconscious sense of them feeling needed is being fulfilled during this time. They're really excited to go to work. They're looking forward to it. We've all seen the videos of online of essential workers going to work and being greeted by people in the neighborhoods. And that, of course, feels very good to see that. And it's almost honorable, such as our military when they're at war, for example. These are frontline individuals who are dealing with this head on. But you also have people who feel, essential workers who feel cheated. They feel like, there's a lot of people getting a lot of benefits right now. People who are not working and are getting unemployment, who are getting stimulus package money, who are getting lots of different benefits. And it's somewhat unfair that they're at home and the essential worker has to work. So my point is that it doesn't present the exact same way, and it can look very different. And of course, you have people kind of in the middle as well. But those are kind of the two extremes that I've seen in terms of essential workers. And we, as non-essential workers, have to respect everyone's process. Not everyone is going to deal with it the same way. An individual might have, a bad week and a really tough time enduring the long hours. And then the next week, the next few weeks, they may be dealing with a lot better. And no fault or no contribution of us, but I think it's important that we show patience and we show understanding and we show just a little bit of empathy regarding someone who's working very, very long hours and also exposing themselves to a virus that certainly has the ability to cause death.
Right. That's an interesting perspective, the perspective that these essential workers aren't all feeling like, you know, like heroes.
Sure.
Some of them are feeling slighted.
Hmm.
And while, there are people who I think for a long time have gone unrecognized,
Hmm.
like, fast food workers, hotel workers,
Hmm.
gas station attendants,
Hmm. Hmm.
who are there 24 hours. Those gas
Sure.
stations stay open all night, and we can pull up and get our gas when we want to. Um, they've been feeling slighted for a lot longer than some of these essential workers who might be feeling slighted. So like you said, I think it's important for everybody to, to kind of be patient about it, because my struggle is not your struggle, but they're both struggles.
Exactly, exactly. And then just the concept of understanding that no one chooses their feelings, right? We can feel honored, or we can feel cheated, and no one made a conscious choice to feel either of those things. We can only control what we do with our feelings. And sometimes when we see a family member or a friend choose to cathart or vent in a way that doesn't fit the schema of what we think that they should do, that's when you get judgment. And that's when you get a little bit of a what's going on here, if it falls outside of the schema of, the honorable sort of, this is really what I want to do, this is my lifelong journey. We all can feel good about that, but anything outside of that, it's almost like hidden feelings. And so anyone who does feel cheated, chances are high you're not going to see them on the news talking about that. Chances are they're not going to necessarily share it with the masses that they feel that way. This is going to be something that they hold on to internally and almost wish that they were in the midst of the normality of what everyone else is experiencing. And don't get me wrong, I don't feel like this is a large number. This is completely representative of the population, but there certainly are people out there who feel this way and really wish that they had a little bit of time to reset as well. That's a lot of what you hear people talking about now, is the COVID-19 situation has forced us into a reset as a human race. Like, most people will agree, like, it's not really, it wasn't meant for us to just wake up and go to work every day and go to work from 9 to 5 and or 8 to 5 and
Mm-hmm.
have a little bit of time with your family, have your dinner, and then just prepare yourself to do it over and over again. Like that, most people would agree, like, life as a human being, we have one life, and it's not meant for us to do that every day. I believe the movie Office Space kind of covered that in a satirical sort of way. But with that being said, a lot of people are agreeing that this has given us an opportunity to really, reconnect with family on a deeper level. And sometimes that can be a little bit tough because we can be impatient with family, but spending time with the people who we love, who we enjoy, even just reaching out and making a phone call to people who we don't talk to every day, people are really appreciative of that. So this whole COVID-19 thing covers a lot of different topics. And my hope
Yeah.
for humanity is that we come up on the other side with a little bit more diverse of an experience as a human being.
And it made me think about uh, uh, something I saw on Facebook the other day, um, and something I'm seeing more of. A lot of those essential workers finding ways to celebrate themselves
Yeah,
by hashtagging essential worker. I'm an essential worker. You
sure,
know.
sure.
Yeah.
Sure. The whole, I believe it's called the Rush Challenge,
Oh.
which is a very interesting way of highlighting people in different careers and fraternities and sororities, and people of a group of some sort. I've even seen it, like, specific high schools are doing it. And so,
Okay.
but yes, I do think that it may have started off with essential workers or a subset of people battling the coronavirus. And what a great way
Yeah.
to highlight and to expose and to show the world our people who are holding it down for us. And I hope that we continue this and don't just stop
Right.
with it, because this has bigger implications. I mean, me as a psychologist, I love to see people, black and brown people of color, being
Hmm.
exposing themselves to our young people, to our youth.
Yeah.
to our 13-year-olds who, unfortunately, sometimes in their neighborhoods only see being a professional athlete or um, the life of crime and drug dealing and criminal elements. They see those two things as their true only two options. And so
Yes.
this is wonderful that we can see 25 nurses, right, or
Right,
a
right,
bunch of
right.
doctors and gynecologists and dentists and psychologists and everything else. And so there's some it's a double-edged sword, and of course no one would have wanted COVID-19 to happen, but there are some silver linings happening here as well.
Silver linings being those new ways or extended ways of coping.
That
Uh,
too. Sure, sure. And let me just talk
Excellent.
about that since our topic here today is essential workers. If I had to kind of give a little bit, a few tips or a little bit of advice, the first thing is that we have to recognize that essential workers are their own unique subpopulation. They're their own unique sort of sample of the population. And
Yes.
so even you and I talking about essential workers here today doesn't completely capture exactly what it is to be an essential worker. If you don't know what
Right.
that is like, then everyone else is just kind of, giving their opinion and everything else. But I recommend that essential workers engage in an essential worker support group of some sort. It can be
Hmm.
formal or informal. It doesn't have to be something that you find online, but even just them having a Zoom conference, for example, and 10
Oh,
of
that's
them
great.
being on the line talking about their experiences, both good, bad, and ugly. What really works with group therapy is that
Hmm.
you feel like you are not the only one going through this. You feel like you are not crazy for feeling guilty. You are not crazy for feeling overwhelmed. You are not crazy for feeling like this is unfair. You are not crazy for feeling fear and anxiety. And the moment that
Mm.
you can connect with other people who have experienced exactly what you experience on a day-to-day basis, now it kind of feels like, all right, I got something to go with. And of course, there's sharing of other tips and strategies that are successful. But that's one thing that I certainly recommend. I also recommend positive psychology, meditation, deep breathing, uh, progressive muscle relaxation. One thing that we fail to realize is that when we are amped up and we're working long hours, our body starts to kind of get used to it a bit. And it's
Oh.
an artificial sort of way of keeping us going. That's not healthy long term, and we all understand that. And of course, we
Mm.
hope that this is a temporary thing we can get beyond. But to combat that, we have to do things that are going to be
My conversation with Dr. Outlaw on essential workers will continue on the next episode of the Bay Area Mental Health Hour. Please visit our YouTube channel, tap on the subscription and notifications bell to receive updates on new episodes.